So I'm Dr. Macleod. I'm an intern in urology at the University of Washington, and we studied risk factors in renal cell carcinoma. The reason for this study is that renal cell carcinoma has been increasing in incidence for the past 25 years. Partially, this can be attributed to increasing diagnostic imaging. However, such a rise also suggests the presence of environmental and modifiable risk factors for renal cell carcinoma. Many of these have been studied in the literature. Those that are the most robust include obesity, hypertension, smoking, and male gender. However, many others have also been studied, but only retrospectively or in small case series. Therefore, we sought to study a wide variety of potential risk factors that others have examined using a large prospective community-based cohort known as the VITAL database, which stands for Vitamin and Lifestyle Study. It's basically a large cohort of approximately 77,000 individuals conducted in Western Washington between the ages of 50 and 76. These individuals were volunteers who completed an extensive survey between 2000 and 2002. And then those records were linked to the surveillance epidemiology and end results cancer registry through 2009. To test the association between our risk factors of interest, which are listed here, and renal cell carcinoma, we performed Cox multivariate proportional hazards regression in a base model adjusting only for age and gender, as well as a multivariate model which adjusted for all variables. And our outcomes are shown over here. Basically, we were able to confirm some of the more widely established risk factors, including obesity, hypertension, a history of smoking, also a history of kidney disease, which has not been widely studied in large prospective trials. I thought it was particularly interesting that there's a cutoff for statistical significance in the fully adjusted model for those who are morbidly obese, whereas lower degrees of obesity were not significant. And then for smoking, there seems to be a dose-dependent relationship at 20 pack years. Viral hepatitis was significant only in the base model. Alcohol, which has been shown to be protective in some studies, was not significant. So I think what you can take away from this study is basically that we were able to confirm the well-established risk factors as well as a suspected risk factor of prevalent kidney disease. And these dose-response relationships in level of obesity and pack year history of smoking merit further research at the mechanistic level as well as targeted clinical intervention.